Okay. I am the speaker of the day for ICFAD. It's an Institute of Cosmetology, Facial Aesthetics, and Dentistry. The institute basically works in about the education of the facial cosmetics and the skills which are developed in the dentistry, like basic endodontology, implants, and all. So about this, we are conducting this workshop about uh, the dental practice during COVID lockdown, during and after lockdown. What will be the impact? How the practices will be modified? What all changes has to be taken in the practice so that we can work safely as well as smoothly. So let's start. Sure. Coronavirus. These days, we are hearing a lot about coronavirus and worried how to start back your practice again. There are a lot of things. Everything in the world right now is talking about this virus. There must be something deadly about it. And that's the basic, it's the size of the virus, which is too small that even it's smaller than a bacteria. It's about 100 to 160 nanometers in size, which is further very smaller than bacteria. A bacteria usually of a size of microns, and it's of nanometers. The basic appearance of bacteria, it looks like when we see it under the microscope, sorry, ultra microscopes, we see it and we find that there are some spike proteins present over it. These spike proteins are responsible for attaching the viral DNA, the viral RNA with the human host cell, and this is enabled by the enzyme called ACE2. And it's just an introduction about it. We'll not be going detail about the enzymes, how they integrate, and what all they will be doing. When we see it under the ultra microscope, we see some halo around it. Corona stands for the halo, basically a appearance of whiteness around the particle. Now the global status, the world, it started as an epidemic in Wuhan, but now it has become a pandemic. It have involved almost every country on the earth, and it is majorly going to affect every person. Now, why is the only COVID-19 is the only pandemic in last 20 years? Do we really see that this is the only pandemic? No, absolutely not. There were smaller ones also, but not really effective at that point of time. SARS and MERS. SARS is severe acute respiratory syndrome, which is basically a transmission from animal to humans, and that also started from China and involved entire world. In 2003, WHO declared that SARS is contained, and it has a case fatality rate of around 10%. Almost 10% of the people suffering from SARS died in 2003, and it was contained. And the similar, again, pandemic that came across was MERS. It is also again an virus disease spreading from animals to humans. It is basically seen in Saudi Arabia. So, and it is still not contained. Has a very high case fatality rate, around 35%. Now, why we are worried about this corona? Why we are worried about this corona? The reason is quite simple. As we see, hello, I am muting a person, and by default they're putting it on. Okay, mute all. Great. So why coronavirus is so much in the news these days? It is not really that much fatal like the other viruses were, like a Middle Eastern, which has a 35% ratio of fatality rate, and the COVID-19 has a rate of around 0.5 to 10%. The huge variation is there because 0.5 is the meager data provided by some of the South Asian countries, and because of the less testing, and the higher range is given by the other developed countries, those who have done the extensive testing and came across this. Instead, this the COVID-19 has high infectivity rate. It can infect the other person very easily, not like SARS and MERS. So that is the basic reason why COVID-19 has become the pandemic. And okay, now moving forward, how does it spread and what are the symptoms? Spread is quite very simple. It spreads from person to person through sneezing and coughing. Basically, respiratory droplets are the major source of the spread. It can, it can involve the person who is standing close to the other person, an infected carrier, or a deceased person can be the transmitter of the disease. Now, the symptoms are quite simple. A person will be suffering from fever, which could be mild or severe. High fever can also be there. Pneumonia could be there. Runny nose, runny nose, and all could be the features. Shortness breath, fatigue, body aches are the basic features which are seen along with this COVID-19. Now, does this virus stay longer on the surfaces? uh, there are studies which says that virus can stay into the environment for around 3 hours in aerosols, which are generally seen in dental practice, cardboards, and the plastic surfaces, stainless steel, up to 2 to 3 days. So these can be easily seen. Sorry. But this is not the only thing. That means a virus can easily stay for 3 days. No, not at all. It The traces of the virus are seen after 17 days on the ship Diamond Princess, which was the only hotspot present on the water. Apart from the land, on the water, this was the only contained zone of COVID-19. Almost half of the ship was half of the person population present on the ship was suffering from COVID-19. So this ship, after 17 days, when the samples were obtained, there were some traces of COVID-19 were detected. And we are still about to explore how long this virus will stay on the surfaces. What is the behavior of this virus along with the temperature changes? There are a lot of much has to be still exploring. Now, who is at the risk? Almost every person on the earth is at the risk, because a person meets another person on a daily basis, and almost every person is meeting other person, and we don't know who is the carrier or who is infected person. It has a high infectivity rate, so it involves almost everyone. So every person on the earth is at the risk. Now, but every person doesn't mean that everyone is at greatest risk. Healthcare workers, especially the dentist and the paramedics, are at high risk. Why dentists are at high risk? Because of the presence of basic thing, aerosols. Aerosols are present in the dental laboratory in high number. So they are the only reason that dentists are at high risk, along with some medical specialities, which includes ENT, where nasopharyngeal tubings are done. Anything related to the respiratory system, like if we have to give any intubations done or anything, that can these persons are at high risk. Rest other professions like lawyers, janitors, and courier person, everyone, they are at relatively less risk because they are working in the far proximities. They are not working closer, but their exposure is high because of the poor hygiene habits. Now, for the dentist, saliva is very important thing. We cannot control saliva in the oral cavity. We cannot stop the salivary flow in the oral cavity. And in the oral cavity, the human salivary gland cells, it has ACE receptors. These ACE receptors that bind with SARS virus receptors present on the envelope and enables the gland to be infected. Once the gland is infected, it can easily involve the entire gland, and the secretions are always virus based. whatever the saliva is whatever the saliva is flowing in the oral cavity, that is always containing a viral load in it. So what all we can do to flatten the curve? Can we first of all, why the flattening the curve is, it's in so much the talk. Can we not eliminate the virus? Absolutely. As of now, we don't have any treatment, no vaccine. The only thing we can do is reduce its impact. If we can reduce the impact, that is good for the mankind. And for the dentist, how he can involve to reduce the impact is basically not using air rotors, ultrasonic scalers, three-way syringes, any needle stick injuries, or practicing poor sterilization methods. These are the things, if we are doing in our clinic, that can surely elevate the curve. If we take care of such things, they can reduce the curve of the virus infection. So, is it wise to shut down a practice during lockdown? Actually, we should not be closing the practice under the lockdown period. If the doctors are not available in lockdown period, who will serve the mankind? Doctors means not the dentist I am talking about. I am talking about all the doctors, whether it is a dental fraternity or a medical fraternity. Doctors are bound under Hippocratic oath to serve the sick, and we have to serve the sick at this point of time, not the treatments which are done elective basis. In the entire medical field, 90% of the treatments are done electively, not done on the emergency basis. So especially in the dentistry, this is really true. We create the need, and then we do the treatment. We barely see, very less percentage of the cases, those who are running with the pain and all. And at this point of time, if we shut down our practice, that will be bad for us. So there are, not all soldiers, they carry gun to save the country. Few wear the mouth mask and take up their instruments to treat the patients. So we are also treating the patients, saving the country, and protecting the country from the disease called COVID-19. Okay, so what all routine treatments should be deferred at this point of time? Anything which is elective, a routine treatment, that should be deferred at this point of time. Only life threatening procedures that could be involving any trauma to the maxillofacial region, any jaw fractures, any cellulitis or any abscess, any diffuse swelling which is compromising the airways, life threatening procedures has to be taken care by every dental surgeon who is competent enough to do such cases. Shutting down practice, again, in case of urgent dental care needs, we have to take care, treat the least invasively. Treatments has to be done least invasively. That includes severe dental pain, pericornitis, any dry socket management, fracture, gingival pain, any pain that needs management during this COVID period has to be managed. Rest other thing can be linger on for some days, some months. We till the time the virus is contained or treatment is available, we have to linger. Now, these are the list of the treatments that are advised by State Dental Council in Maharashtra. What all treatments and what all specialities can do in the dental field only. In oral medicine, oral conservative, everything. They have do's and don'ts. But basically, everything runs around if the patient is in pain, he is not able to function properly, treat him on the urgent basis in every specialty. I have the document available for this. I'll show you if you want it on the later. I can mail you that, or I can, WhatsApp in the group if required. Okay. Does every doc should start practice now? Certainly, the answer is no. We should take care of the people who are above 60 years of age, because old people or the person who are above 60 years, they are much more affected by COVID-19, and the person who is suffering from other comorbidities, like anything which is compromising their immune status, or any predisposing factors like diabetes mellitus, chronic liver disease, heart, kidney, anything. Does everyone should start practice? Absolutely no, because doctors and paramedics, if they are above 60 years, they should not start working, as their immune status could be low, and anything which is lowering down their immune status, like diabetes, any chronic liver disease, lung, asthma, anything, which they can easily take up any secondary infection, they should not start practice at this point of time. Any person who is on chemotherapy or taking a steroid treatment, since we know that steroid always suppresses the immune system, so a person who is taking that thing, we should avoid that. Person should not practice. And a pregnancy, in case of a female, if she is pregnant, till now we don't have much detail about how does the virus responds in case of a pregnant females, but we believe that there must be some issues, so a pregnant lady should also not practice. And obviously a seropositive cases, those who are determined positive, they should not practice at all. So practice with, now how we should practice, we should practice with standard precautions, and the objectives of any practice, any practicing method, could be protecting yourself first, protecting your patients second, and protecting your family and the community at large. These are the basic three objectives of any kind of a practice method. So this is a circle of infectivity. We can easily see everything is running around the dental treatment. That dental treatment in which aerosol is generated. Aerosol is generated. This dental treatment where aerosol is generated, and if the person is infected, that can easily, infect other person also. Anything, basically a dental chair can be contaminated, and these all will be in turn infecting all the dental fraternity, or the basically the dentist at large. Okay. This is a very short video. We don't want our patient to pass through this, so we have to take care. Uh, okay. This video demonstrates, if a person who is coming to our clinic, we should not be behaving in such a manner that he comes on, we put water, and then we put up the surfactant or surf over it, then wash it properly. This is not the way we should deal our patients. So for this not to happen, we have other things. Okay, the standard elements of precautions that should be taken, they are adapted from WHO and modified uh, as per need. There are standard elements of precautions. Telemedicine is the first thing which we should practice. Visual instructions, hand hygiene, respiratory hygiene, PPE safe practices, and a lot more other things are there. We'll be discussing them in brief later. So first thing is telemedicine. So telemedicine, yes, we can practice telemedicine by the law as per the guidelines of WHO, MOHFW, that is Ministry of Health and Family Welfare. We should do telemedicine first, tele dentistry or tele practice of medicine first. We should ask our patients to, give us proper detail over the phone and maintain the record for that in the format, and obviously at the end we can obviously charge them. This is not, means as per the guidelines, a person or a doctor, they can charge. So these are the basic informations which we will be needing in a, in a written manner by the patient. We will send the set format to the patient. They will share the name, age, gender, anything. Fever or cough is the important factor we should ask. And chief complaint, what is the chief complaint, why they are coming to us, any regular medicine, if they are taking any treatment for dental pain taken till date. And this is the basic info which we should take first. And we should ask our patient to send us at least 5 pictures of clear resolutions of the offending area which is causing the trouble. Telemedicine is usually practiced first. Means we should come to know what is the problem. That is the basic thing, and we are prepared by our mind what to how we can do it. So share minimum 5 pictures and the payment link along if you want to charge your patient, and it's absolutely right. And this is the pain level score from where if you send this photograph along with the your basic information, patient will be very easily to tell you how much is the pain level, and you can treat accordingly. Now there is a short video of demonstrating of the taking picture. I will basically show you that video. Okay. Can you see my screen? Sachin, can you see my screen? Sachin, raise your hand.
Sir.
Okay. This is a simple spoon which is available. Okay, if we click a photo, without the help of tripod or anything, it's not possible. In different angle, different views, more information is what we require at this point of time. So tell your patient, send the video how to click the photographs, because your patients are very rarely they are able to understand how they can shoot this, how they can shoot this photograph. If you tell them to shoot a photograph, they will send you a vague photograph from which you will not determine anything. So just send a video how to click a photo. They will be very happy to click in such a manner. Okay, then second element of practice is display in clinics. There should be visual alerts or anything that is posted in at the entrance at the strategic areas, basically where the patient enters and sits. That are the main areas we put everything. So display uh, about the virus and the information about how to prevent it in the waiting area, cafeterias, elevators, or the main entry doors. And to reinforce both patients health and care, the important okay, now we must reinforce both everything into our patient coordinators or in the patient, so that they can understand hand hygiene, respiratory hygiene, and cough etiquettes. They should follow it. This is one of the photographs in uh, which I have displayed in front of my clinic. Similar kind of a photograph. Stop if you have a COVID-19. Please inform us and don't enter the clinic. Uh, if you are lying, you can be booked under Indian Penal Code. So this is the basic which I have kept in my clinic. Hand hygiene. Okay, here one person asked me about how you have really kept Indian Penal Code, that it's a law, or that a person can be easily booked by this under the law. Yes, I had done this, because most of the time every patient says that we are fine and they neglect it. Once you write it, they understand the gravity of the situation. One thing is that. Other thing, that we are there to treat the patient at this point of time, not to earn a lot. Basically, we are doing emergency treatments right now. So we should be, patient is not having any issue regarding this. Then comes the hand hygiene. This is the hand hygiene proposed by WHO, in which we can see there are five things. Two befores, one and two is before, three, four, five is after. So basically, we call it as two before and three after technique. So two befores are: first, before you are touching any of the patient, before you are doing any aseptic or clean procedure, you should wash your hands. Second, before after you have exposed to the patient, after you have touched the patient, you have touched the surrounding, or any body fluid exposures has been done. Okay, now how to hand rub? There are sorry, how to hand rub. Okay, so now it's a hand rubbing technique mentioned by WHO, and basic technique in which is available across the net. You can easily find it nowadays. Even schools are teaching this hand rubbing technique also, and we should incorporate into our system. So hand rubbing is important. When we rub our hand with alcohol or any sanitizer, the process of rubbing should be close to 30 seconds, 20 to 30 seconds, while we wash our hands. So it should be laden with any kind of a surfactant for at least 50 to 60 seconds. So that should be the basic minimum, the time that we require to clean our hand. Then comes is the respiratory hygiene. Okay, respiratory hygiene. Now, this is the basic hygiene method in which we tell the person or any patient entering into our facility that please, if you feel any, we see the patient is coughing or sneezing. First of all, we give them a hand, any tissue, mask if required, we give them, and then we tell them to use good hygiene, respiratory hygiene. And if the person is not carrying any handkerchief, any mask, or if we are not able to give anything, so at least tell that person to sneeze in at his arms. In this manner he can sneeze, so that the spread of the sneeze can be contained. Okay, then comes PP. Before jumping into PPE, I just want to say one thing. If anyhow the Zoom meeting breaks up, I would request you to send a WhatsApp back onto the number from where you received the link. We will generate another this Zoom ID after 5 to 10 minutes, and we'll continue the process, because I feel that it said me that your 40 minutes are over. They have given me some extension, I don't know, maybe 5 minutes, 10 minutes, or 20 minutes. So it may crash. If it crashes, we will start it and resume back again. Just send me me or the number from where you got a link. Just send us back. We will share you the new Zoom ID at this number after 5 to 10 minutes. Okay, now PP. Every person in the medical field nowadays has heard a lot about PP. What is PP? This is personal protective equipment. It contains basically six things: a face shield or a goggle, gloves, gown, various thicknesses, respirators, shoe cover, and a waist bag. This is basically what a doctor going to make like an astronaut in today's world. So there are minimum standards of PP, who are the basic standard, full and enhanced. The person who are working in aerosol generating operatories, basically a dental operatory or maybe an ENT operatory, they should use enhanced PP or at least full PP. That is preferable, not a standard PP which is just used for screening purposes. So now moving on, how to do it? We have an entire sequence of how to doing it. First we have the gown, then the mask, then the goggles and gloves, and so on. It's given by WHO and Center of Disease Control, US, and the standard format adopted by Ministry of Health, India. So you find this detail over web very easily. Then comes the second is how to remove it. After wearing it and after doing our procedure, we should have a set format to remove it. The manner of removing is exactly the reverse we wore it. So gloves, remove first, goggles, mask, and then gown from inside out. Okay, so we should not be touching outside surface. There are various methods of removing it. This is one of the first example, and the other ones are also there. So we can really adopt it. And after this, we have to do a hand wash, hand rub, the one after the treatment. We have to inculcate the practice of 2 before and 3 after hand rubbing or hand washing technique. That is must for nowadays. Okay, now moving on, how to use respirators. N95. Why N95 only? We have N100 also. What is N95? And is there any difference between respirator and a mask? Obviously, yes. Before going into further detail, uh, the one below in white color is N100 mask. The one above is N95 surgical respirator. They both are respirators, not the mask. They both are respirators. The N100, it claims that it has a very high, efficacy of about 100%, 99.7% efficacy, but it is not really recommended in the surgical field because when you exhale out, it opens the valve. The valve will open, which will act as an entry of the microorganism inside, maybe the virus. While in case of N95 1860 respirator, which is a surgical respirator, it doesn't have any valve. So the load is, its efficacy is 95%. And the beauty is whatever we generate in dentistry, in the dental field, while doing any aerosol procedure, the small virus particles in uh, one fragment of the water or the one aerosol of a water, it contains lot of bacteria, oh sorry, lot of virus in it. So that can be easily, the mass of the virus is increased, which will not pass through this respirator. So they both are equally good. N100 is not used because of this valve function, and while N95, it has shown similar efficacy for the virus, so it can be done. Now, SOP for usage. And now nowadays, N95 respirator is quite expensive. Earlier, we used to get this mask around 50 to 100 rupees, depends upon the brand. M1, 3M is slightly expensive because they serve the quality as they claim so, while the other brands are slightly cheaper. But nowadays, either they are not available or maybe we don't find them very easily. But soon this thing will be gone over and the stock will be surplus in the market. So but then also the mask is costly, around 100 rupees it will be, and will not be using a new surgical mask for every new surgical respirator for every patient. So this is a standard operating procedure for the usage of N95 mask. I have adapted this procedure from the circular or maybe the guidelines of Ministry Health, in which is AIMS is following that guidelines. 6 N95 surgical masks, 6 paper bags, 6 plastic box, and 6 days. That means we can use one respirator for one day. And when we are using this respirator over it, we must wear a normal surgical mask over it, which will increase the efficiency of the respirator. Primary macro जो particles हैं वो सब filter out हो जाएंगे easily, and the respirator will be used for a longer period of time. So this is the basic thing, and for this protocol, we can use the respirator for around a month. 6 respirator can be used easily for a month if we are practicing on 6 days a month, 6 days a week. So that can be done. Okay, so what now? Basically, a brief intro about what are respirator. They comes under three YN, NRP. They are the when we buy a respirator, we should be aware of what we are buying. So N is not resistant to oil, while R and P, they are resistant to oil. The aerosols which contain oil. And in the dental operatory nowadays, we are using oil-free compressors. So I believe that there should not be any oil in the operatory, oil aerosols in the operatory. So N95 is good enough, while R and P, they are used in the procedure where oil aerosols are created, and they are slightly expensive even also, and have a limited shelf life. Okay, now this is face shield. You may have seen this photographs for a couple of days. बहुत समय से चल रहे हैं. Nowadays a company called Studs who manufactures the helmets, a helmet which is wore while we are driving any two-wheeler. So they have also came up with an innovative idea of making the shield. So, but they have some issues with it. It is not means it is not covering the entire major part is open, while and when we clean the shield from outside with the alcohol swab over a period of time, this hard plastic shield will basically, it will hamper with your vision. It will give you scratches, and all the light which you will see in the dental operatory, the area which you will be focusing on, the light will be diffracted. So it has its own limitation, but yes, we can make or buy a disposable one which we can use and throw them back. They are just made by simple OHP sheets with the help of any foam and sponge and double tape with the help of elastics. It can be easily made. You can find a lot of videos over web how to make face shield at home. So there are a lot of methods. Then comes is the arm resistor. So what is arm resistor? Basically, the arm resistor is is a technique. See, we touch our face for about in a day about 100 to 1000 to 1500 times a day, and every time if we are touching our face with our hand, we are touching the face, touching the eyes. We are just we are involving more the spread. So we should not be doing that. And for uh, stopping this habit of touching the face, if something is done that involuntarily, if we don't touch our face, that will be good for us. So arm resistor is a small procedure which will allow not to touch your face. It's a short video, please watch and understand. It's very simple. So this arm resistor band will remind you that you have to wash your hands first and then start working. Okay. Now these are the basic things what we are using. Then comes the gloves. How to use, when to use, what are we using? Gloves are indicated or non-indicated. This is a standard protocol adopted by WHO in which treatment we should be using glove and where the glove is not indicated. So gloves are not indicated when there is no potential exposure to the blood and body fluids or any contaminated environment. That is, if you are talking to a patient, if you are using your telephone, if you are doing measuring a BP or a temperature or pulse or anything, and even if you are injecting subcutaneously and intramuscularly, any injection, if you are delivering it, you doesn't need to wear the glove as per WHO guidelines. Wherever, if you are entering into the any kind of a vascular access, any surgical procedure, any procedure which involves the contamination by blood, you should wear sterile gloves. So, and examination gloves, what we are using in our ordinary practice, a simple gloves, not a sterile one, that comes in a box of around 100 gloves in a box. They are used when we are touching any body, when we are touching blood and body fluid secretions or any soil body fluids. So they can be used there. So that indicates if we are doing any major treatment, that is majors or a minor surgical procedure, maybe a removal of the third molar, we should wear a surgical glove. Any alveoplasty or any procedure which is involving a minor surgical procedure, we should wear sterile gloves. And a simple root canal or a basic treatment should be done ideally under the sterile gloves method, because we should reduce the bacterial or the viral load. But if we are doing it in basic treatments also, where we are removing the soil dressings or anything, we can very easily use examination gloves there. Then adapting the safe practice habits. Okay. Now, when a person is coming to your clinic, we must take first thing is measuring the temperature by non-contact thermometer. Why non-contact? Maybe we can use a simple thermometer. Non-contact is more preferable because of the chances of cross infection. And putting up a sterilium or any basic, hand rub, or maybe alcohol hand rub in the waiting lounge is preferable. And the operatory, we should now start using gowns and head caps for the patient also. So gowns, if a person is coming from outside, he is wearing his clothes, and if we make him wear gown over it, or maybe without the clothes underneath, so that will be beneficial for us, because that is decreasing the viral load into the clinic. The basic thing that we are practicing, we will be practicing in future. We cannot make the environment absolute virus free, which is not at all possible. But yes, we can reduce the viral load to the maximum. That we should practice. So patient gown, patient head cap, and wiping the face with povidone iodine is recommended at the dental chair now. And telling the patient not to touch here and there is very important. Okay, then comes is the mouthwash or the goggles. First of all, whenever a patient sits onto your chair, make sure that a patient will wash his mouth with either with betadine solution, hydrogen peroxide, or 0.1% hypochlorite, if possible. Chlorhexidine is not used. Why it is not used? Because it doesn't oxidize the virus, and if it will not remove the virus, it will not be of any use. If we really want the virus to be oxidized, the hexidine mouthwash has to be used for 10 minutes, which is not possible for any person to do it. So that's why iodine, basically betadine, is a best bit to work on it. 1% betadine solution will show its efficacy within in 30 seconds, and while 0.2% will take around 1 minute to show its effect. Even hydrogen peroxide is similar. The more the strength, the lesser the time. In future, we'll be very soon maybe having an antiviral mouthwashes also in the market, readily available with cyclodextrines. So they will have an effect to rupture the viral membrane, oh sorry, a viral envelope, and reduce the viral count. So cyclodextrines could be the future. Now, shall we use rubber dam into our practice? We must use rubber dam. Without rubber dam, ideally, practice should not be done. If possible, in the treatments where we are doing any fillings, any root canal treatment, rubber dam must. Our patients may complain for that they are not feeling good or anything. But seriously, if you are a doctor and you don't want your treatment to go bad, so put a rubber dam. Rubber dam will contain the saliva inside one part, and the only the tooth will be exposed. First thing is that whatever aerosol you will generate, that will be either of the water, tooth, and nothing other thing. No contaminations. If there is any contaminations, you will remove it with hypochlorite very easily. So saliva will be one side. Chances of the spread of the aerosol which contains virus will be very less. First thing is that. Other things, it really increases the uh, means increases the prognosis of the treatment. So rubber dam must be used under any circumstances. If it has to be used for any restorations, any root canals, it will be problematic. Your patient may complain, but really, uh, for the betterment of the patient, and after putting few rubber dams, you will be even confident. In first of the cases, in initial cases, you will feel problem how to put a rubber dam. Your patient might complain for that, but once you have good knowledge how to put it, it will be a game of like 30 seconds, and it's easy. Okay. Then safe injecting practices. At any cost in the clinic, we must avoid needle stick injuries. Any injuries with contaminated person. We don't know a person, a patient sitting on our dental chair is either uh, physically fine, or basically he is not a sufferer, not deceased, or a carrier, or a deceased. We don't know about its status. So believe it that every person is a carrier or deceased. So in such cases, and under any circumstances, needle stick injuries or any kind similar to that, maybe while doing a periosteal elevation of the gums, sometimes periosteal or maybe an elevator that pricks into the other hand, that should be avoided under any circumstances. Uh, First thing is that we should know how to use these. Second, maybe double barrier technique is of good help. So double barrier technique reduces the chance of penetrations. So we must use double gloves. First glove, double gloves means one glove under the other. That is one of the best idea to use it. Then extraoral suctions. Just couple of days back, this device came to an Indian market. It was earlier there in American market, US, it was available, but in the Indian market after the corona, this device came, uh, and they claims to be the extraoral aerosol, sucking device. Whatever aerosol is formed onto the dental chair, either while doing any scaling, any aerosol generating procedure, maybe a air rotor, so that can the aerosol can be sucked back, but the efficacy of this is around it's almost the 50% of the original. If the aerosol generating without the rubber dam is suppose 5,000, it can suck back easily to around 2,000. So they are not making the field aerosol free, they can reduce the aerosol load. Okay, so we should practice in a manner that whatever aerosol is formed, at least it should not contain any bacteria. So we should practice in a manner. Then comes autoclaving. Autoclave each and everything thoroughly. If B class is available at your practice, that's really good. That will give you a very dry instruments, dry everything, dry linens will be coming out of your autoclave. And if you have a cooker based, please use it and use it thoroughly. Okay. Then comes is the ultrasonic cleaners. These ultrasonic cleaners are available in the market very longer time, and at this point of time, whatever we are treating our patients, any instrument which is contaminated, we should be putting in the ultrasonics cleaner. If we don't have ultrasonic cleaner in our practice, at least we should be putting our instruments directly into the tray or any any container which is containing any bacillocid solution, which is the solution responsible for you know responsible for reducing the bacteria and the degradation of the any debris which is being laden over the instrument. Hypo should not be used under any circumstances here. Why? Because hypo is highly corrosive. So it may rust your instrument, it may blunt your instrument, so hypo must not be used. And if you don't have bacillocid solution, at least you should use soap solution. Then comes this environmental cleaning. Okay. Now fumigation. Okay. I think that maybe very few practices has this fumigators in their setup. There are two kinds of fumigator designs shown in this picture. One is basically gun based, other one is based upon the basic fumigator. So the basic fumigator has an issue. It can be used with formalin tablets, but when it when the fumes are generated, when they stick to the wall or any surface, they may leave white color onto the surface. So this fumigator is actually leaving marks or any stains over to the surface of the operatory, which makes it even more dull. And the other one, the gun design, this is an atomizer, not a fumigator. We put the water along with bacillocid solution into it. It reduces into the micromolecules of fragments of it, and it works in a method of atomization. Okay, now going further, what all we can do, we may use double exhaust method in our operatory. Putting a single exhaust can easily throw whatever the aerosol present in the operatory, and if it is a double one, the efficiency will be much more higher. Nowadays, the standard recommendations are coming to use HEPA filters or negative pressure rooms, which is again a costly procedure. But yes, at least we can use double exhaust to reduce the flow. Okay, now comes the restricted use of AC. ACs must be used with a restricted flow. Okay, can you see me here? Okay, great. A restricted use of AC, the change of the filters. The basic ACs are not recommended to use in the setup. So we should now starting to use ACs with HEPA filters. It's a 3M filter which is available in the market, uh, which is kept over the normal basic filter of the AC, and it will reduces the load of the microparticles into the operatory and provides us a clean air. Okay. Now, safe handling and disinfecting patient equipments. It's very important. We should take care of doorknobs, light switch, cabinets, and everything, whatever is coming into the contact of the patient. We should be wiping every clean area in the waiting regularly on a regular basis and screen the patient for that. Then comes dental chair disinfection. So dental chair disinfection has to be done after every patient. Now, every patient. This is a plastic bag kept over a dental chair. This is a plastic cover kept over a dental chair, which has an advantage of whatever is contaminated, it will be over the plastic sheet and it can be easily disposed of. So it will not disturb the entire field. First of all, that, and apart from that, the non-covered areas can be cleaned with either H2, either with bacillocid solution, or maybe glutaraldehyde was used earlier, but nowadays it is not really recommended because of its toxic nature. Bacillocid is relatively less toxic, so we can use it with a dilution of around 1 is to 600. That is efficient enough. 1 is to 600 dilution is like 10 ml in 6 liters of water, can be used thoroughly to wipe off the surface, and that will make it bacteria or any microparticle, any microorganism free. Then comes H2O2. H2O2 can be used for cleaning the tubings of the chair, which contains normal water for air rotors and scalars. They can be cleaned with this. Now, there was a study done about the disinfectant efficacy of the bacillocid and phenol, and the study determined that dilution of 1 is to 600 of bacillocid is effective to give no growth of this Acinetobacter species from 5 minutes to so on if it is applied onto the surface. The more the dilution factor is increased, the growth is easily seen. While in case of phenol, the time taken is 10 minutes. So we have to consider this. If we want to clean our operatory, we can use bacillocid for cleaning the dental chair, and it will not put any stains over or any corrosion to the dental chair also. So safe, then comes safe handling and cleaning of the soiled linen. Put all the gowns or any clothes in the changing room in the cloth basket, and they has to be washed with detergent and sun dry. Uh, Heating, basically washing it within hot water along with detergent will increase the, it will reduce the timings of washing. The efficacy will be similar. The warming effect will, agitate the action of the detergent, will increase the action of the detergent, and the work which has to be done within half an hour will be done within 15 minutes per se. And the only detergent can also be sufficient enough to clean the clothes. So if uh, whatever the way we want to use, that's your choice. Waste management is the final thing what we are looking for. Follow the guidelines blindly, and whatever you are getting into your facility, first of all adopt the waste management. There are few practices in India, they don't have even waste management service. So please adopt that first, and after adopting it, follow them blindly. Whatever has been guided by the biomedical waste management rules, follow them. Okay. Now this is about the waste, solid waste or the waste generated over the chair, has to be how it has to be used. While what about the water waste which is being generated from the chair? That has to be diluted with hypochlorite. So hypochlorite has to be diluted with hypochlorite into the pit collected from this. It collected from this, the water has to be cleared and diluted with hypochlorite. These are the various concentrations which can be used, and how much they have to dilute, it's a chart for that. If you have 5% commercially prepared hypochlorite, you can reduce it to 1% by diluting it into, to prepare 1000 ml of 5%, you need 200 ml of hypochlorite in 800 ml of water. The basic dilution formula is C1V1 is equal to C2V2. You can find it over. It's a chemistry formula used in plus two. So this formula will help you to reduce any percentage of the commercially available liquid to the other percentage desired. 1% is or 2% is quite efficient for doing such thing. Okay. And other thing, if you believe that hypochlorite is expensive, I don't think so. If you want to find it over the web, it is available at a price of around 20 rupees per liter. Uh, that can be used for cleaning, even, our operatories, dilution with the waste generated. So it's a cheaper price, 20 rupees per liter or maybe 30. Over the India Mart, you can easily find it. Okay. Now, these are the various standard operating procedures which I believe that they should be followed. You can modify it according to your need. This is a consent form available at my clinic for COVID self-declaration form. Here it includes almost everything: name, age, gender. Do you have the symptoms? A questionnaire for the symptoms, and at the end, I have even mentioned that I hereby declaration by the patient. If any false information is given, they can be charged under the section of IPC. So, and my patients, they really sign it, and I make them sign it. And one more modification I have done in this right now, a couple of days back, that I have included. Nowadays medical legal cases are happening a lot in India. Even the patient may, complain about that we have went to this clinic and we got the viral infection. You gave us infection. They may sue you for that, or maybe they may claim, or they may come to blame you for that. Even such case, a simple blame can be addressed by putting a line here that if uh, I get the disease, neither the doctor or the team or the clinic should be held responsible for that, and they sign it. SOP for the patient coordinator. What is patient coordinator? This is the term which is being used in my clinic now. I don't have a receptionist at my clinic. If I say I have a receptionist, the function of the or the purpose of a receptionist is just to manage the reception, and I seriously don't want her to manage the reception only. So I devised a term called patient coordinator, which is which gives her everything to do. The workload has been increased, or maybe smart working has been done by me to mm, you know work more effective manner. So measure basic vitals. The patient coordinator SOP, standard operating procedure for patient coordinator. They has to measure the basic vitals, fever every time the patient comes to clinic, maybe a old patient or a new patient, they has to take the vitals. Okay, we don't know when the patient has contacted other patients, so we should take proper history and make sure that every patient should use hand sanitizer first, practice good and general respiratory hygiene habits, and at every visit, self-declaration form is mandatory of the COVID. Since we don't know if a patient visited me today and he will be visiting me after 3 days now. So I don't know about her status or his status, whether he is suffering from any disease or he has in contact with the person who is coming from abroad or anything. So I have to really get this filled every time. Make your patient wait in the operating area for 10 minutes at least. If it is possible, make your patient wait and analyze her general his or her general health. If there is heavy breathing, coughing, or anything is going on, you can easily see and ask the patient. That may be alarming situation. And if you feel everything okay, no emergency is there, and you suspect anything relevant according to this protocol, you can easily postpone the appointment for 2 weeks and schedule it later. So again, SOP for the patient, very similar. Old and new patients, if they are coming, new will directly land in your operatory without taking any appointment. We have to take that patient in. While old and recall, we make sure that we tell them to call us before they are coming. Every time we should tell them to call us before coming. So that will help us to take a basic history over the phone itself, and tell them to use the handkerchief when they are coming to the clinic. Don't touch anything unnecessary here. Here, I would like to mention one more thing. Usually, our waitings are flooded with magazines, any toys or anything like that. So we should remove those things from the operatory. We should put base waiting area. We should remove those things from our waiting area and keep the basic things there, so that there are no chances of touching unnecessary here and there. So COVID-19 screening test has to be done. Basically, we have to check the vitals, take the fever, and examine the patient after doing mouth rinse. And treatment is explained and carried out if everything goes fine. So this is the basic protocol we have to follow. And similarly, it's almost similar other way around. These things are inculcated into the practice by the doctor also. Doctor has to take the history in detail and treat every patient in a manner that he or she is a suspected COVID patient. Don't take it for granted. Take it in a manner that they are suspected. Then treat accordingly. Okay. Now, when you are going back to your home, so from your clinic, if you are going back to your home, we should. Okay, just give me a moment. Okay. We should be using N95 mask if available. N95 mask, if what we are using, preserve it properly, wash your hands, change, uh, sanitize your basic phone, key, wallet, shower. If you have shower facility at your clinic, take it there and change again, and put your old clothes for washing. And either way around, if you don't have a facility to take shower at your clinic, you can devise this thing, or arrange these procedures according to your convenience, so that when you reach home, you will take shower and wear a separate set of clothes, not the one which you wore at your practice. Okay, now treatment guidelines. So now this is the time to jump back to our basics. Whatever we have done as a fast moving dentistry, we have to rethink it again and do the basic treatments now. So low speed dentistry is the new incoming thing, and art along with it. So art is basically atraumatic restorative treatments or the techniques which has to be followed. Any treatment which will reduce the aerosol flow or aerosol generation is highly accepted now. Oral prophylaxis, use of the hand scalers. Now, people may say that efficacy of ultrasonic scaler is more than hand scaler, but the studies has shown that efficacy is quite similar. It is just the technique which you should learn. And hand scaling done with good instrument. Maybe you have a GDC instruments or the basic Hugh Farady instruments. They have good cutting edges, more sharp edges, and easy to do the treatment. Less strain over the fingers. So hand scalers has to be used. When not possible, make sure that you are using ultrasonic scaler under N95 only. Then comes art. Art is atraumatic restorative treatments. Now here we had a, in past we have a treatments called uh, cavity preparation or cavity cutting with air rotors. Now this is the time we should change our method to chemico-mechanical methods of cleaning the cavity. So we use Carisolve or the different brands available in India. In India is Carry Care, Papa Carry. These are the brands easily available in India. We should use them. They basically degrade or dissolve the caries, and we can scoop them out very easily. So this is a photograph which shows in A we can see the lesion, frank lesion, while in F the cavity is clear. If we have to sometimes, if the caries are undermining caries are present, we may have to generate an excess. So to generate an excess, the low speed dentistry is encouraged for this. We have to use micromotors and all our burrs, the basic diamond friction grip burrs. They come, we have a stock of them. So when we are not using the air rotors, we should be using them with adapter, the basic adapter, which converts a friction grip burr to the micromotor operatable burr. So these adapters are easily available in the market around 150 to 200 rupees basic price. They are available. One adapter is good enough to use until it is worn or broken up. It is good enough to use a number of times. It can wear the burr inside and do the necessary cutting. But the speed is slow. I really accept this thing. It will gonna take time to prepare the tooth to do the functions now. So, but at the same time, we should avoid to generate aerosols. Okay. Now, other thing which we can use is SDF, silver diamine fluorides. They can be used, and they are basically, they can easily contain, easily dissolve the caries and remineralizes the tooth structure, prevents the biofilm additions. And the only bad side is they, when it is applied, it gives a black stain over it. So if we start practicing smart SDF, uh, in this, we clean the cavity first with the help of basically a micromotor, not an air rotor. I used to practice this, so it's coming on my mouth now with air micromotors, and then apply SDF, clean that area again. Then we can use GIC or any filling material over it. So that can be done. Otherwise it will gonna show the black scar, black area present, which is non-active, non-carious area, but it is black in color. Okay, now if still we have to use any handpiece into our practice, air rotor handpiece, we must be using anti-retraction handpiece. Anti-retraction handpiece are those handpiece which involves they don't suck back whatever the field we are working in. So they don't suck back the saliva or the debris into the uh, system, into the air system or the chair tubings. So they don't give the cross infections. So in this I want to say that anti-retraction handpiece can help us not to cross infect our patients. So this is a small video which shows how does an anti-retraction handpiece will look like, so that we'll be able to understand does it really functions. This is a normal handpiece. You can see that air is blowing from that, and here I can very easily see some black line going up after the stopping the handpiece. This is a retraction handpiece. When we use anti-retraction one, this black water which is going up to the handpiece will not go. It will stop as it is. So we should start using anti retraction handpiece now. Okay, I hope that you can see there is nothing going up. So basically, carry out all the procedures just to avoid one those foam aerosol. We can carry out all the procedures. Try generating least amount of aerosol, because aerosol will be a problem. We can contain everything. We can take care of disinfection, but we cannot control aerosol at all. So try not to generate it much. Dental clinic SOPs during lockdown. Okay. So what we will be doing, I hope that most of us has closed our clinic as this at this point of time for a couple of days, but just shutting the clinic on a random basis will seriously make an effect to it. So we should clean the clinic. If we shut the clinic in a random manner, everything, every water, every contaminated area, every debris is going to stick into our dental chair system, or maybe the system, air system, or the valves. So which will gonna affect the efficacy or the functioning of the chair. So in operatory we should clear the chair side vacuum traps, screens, everything. We have to clean and lubricate the valves, run the vacuum cleaner through the lines. We have to clean everything, shut all the water valves, remove and clean slow speed motors, everything. And basic thing, please don't forget to lubricate and sterilize your handpiece, and again lubricate them. Please don't forget them. If you have ever used your handpiece or an endomotor, if there is any contamination with hypochlorite at that point of time, it will gonna rust the handpiece or maybe the cartridge inside. So if the cartridge is rusted, it will not function. So please, if it will rust, avoid it, lubricate it. First lubricate and sterilize, and again lubricate it and keep it for that until you are starting your practice on a daily basis. See, once the thing is in the flow, they are working, the instruments are working, they will not gonna rust. But if we are going to leave them at a random point of time, they will surely gonna clog and rust. So please maintain them on an urgent basis. Okay. For the technology, if we have left the clinic, remove everything, maybe sterilizers or the computer peripherals, scanners, printers, perform the backup. And if you are using RVG, maintain the, the radiographs, the IOPS that has been in your system. Please take a backup of that. You don't want to lose your data under any cost. So please maintain them. Remove and clean the ultrasonic cleaner. If you have in your operatory, please drain and clean that. The standing water will be of no good use in the ultrasonics cleaners. And remove and turn off all the X-ray units. Okay. Communicate. Okay. Now at the end, we should communicate our patient with lockdown. We are going to close our practice. We should tell our patients that we will be available. Please tell them by the various methods available over the web. Please guide them what to do, maybe your website, social media platforms, or the SMS service, your simple mobile phone or a WhatsApp account. Send them message and tell them that you are available over the call. Share them the link that you are available and respond them. Okay, now coming to the finances, how to manage the finances. This is the most trickiest part. Impact of COVID-19 on GDP. It is this COVID-19 will surely have a big impact on Indian GDP. If the GDP will lose, it will gonna impact our business also. So my clinic, it's not a charity, it's a business with ethics. I am practicing with ethics. So here, if whatever I'll be getting the patients, my patient flow will be reduced, but my overheads, they are increased now. So I have to tell my patient, initial estimate by Moody. Moody is an agency which estimates the growth of any country. So initial estimate of Moody in 2020 before COVID was close to 5.3%, which is a good GDP rise for a country which is developing country like in India. But now they have predicted again to the half of the original one, close to 2.5%, which is quite less. That means less circulation of the money into the Indian market. That means more poverty, basically more poverty, and more you will be not be getting that much desired number of patients to sustain or to run your practice. Now, the person who wants to work in this practice, in this kind of a scenario, has to create a brand value about this practice. Upgrade your clinic, tell your patients and tell everyone in your locality that you has upgraded, you are taking care of this cross infection, you will be managing everything. Create a brand value about your clinic, that yes, this clinic is serving good treatment under any circumstances. Create a value. And over the social media platform, whether it's a Facebook or in Instagram. And second most important business platform is Google My Business. Please use it. If you are not using it, it's very important, because the most of the searches they are generated over the web is through the Google only. And first result over the Google is shown after, means after the first few ad categories, or maybe the bought out categories, the first few links, they are shown by the Google about your business only in the map section. So please make Google My Business uh, profile if you don't have the one. So, and tell your patient that their bills can be settled by EMI options. You have an EMI options. You tell your patient to pay through card, and you may generate an InstaMojo or maybe Razorpay link for this. Generate a link, tell them to generate an EMI option. Maybe the burden of the interest will be borne by you if you feel so that you can reduce your profit margins and give the person EMI. Try to do the way you want to practice is your choice. Give them EMI options if you want to do it. There are options. You can use credit cards or debit cards in these platforms, and with some charges. So you can generate easy, free, basically 0% interest EMIs also. Okay, now will this gonna increase our cost? Yes, certainly yes, a big yes. This will surely gonna increase our cost. So the cost will be passed over to the patients with at least 10 to 15% rise. And if you don't want to increase more cost, please try to finish the maximum treatment in one sitting. Maybe you have to give a rest in between. Please give them. Your PPE will not be wasted. Your environment will not be wasted. Make the patient doing more, more treatment will be done in one sitting. That is good. If treat in a manner that you are treating a patient in a GA setup. Under the general anesthetic setup, if any pedo patient is being treated, all the cavities, all the restorations, all the root canals has to be done in a single sitting. So treat in such a manner that everything will be done in a single sitting with a proper gap in it. So your PP, your clinic, disinfection, everything, every cost will be reduced, and that in turn will be passed on to the patients, because you are not using PPE again. The cost may be similar, or if you want to pass, if you want to retain the profits, that's your choice. So treatment cost will gonna increase, and the survivor will be the those who will be working with the clinic branding and clinic marketings. So please work for that. Okay, now this we I kept this slide deliberately. Earlier, the style of practicing dentistry was this: no head caps, mask not worn over the nose, attendant without the mask, just working. And this now we'll be looking forward to see ourselves in this astronaut suit, protecting ourselves, our community, our family at large, everything. We have to do this. So the basic ideology is we have to increase our working standards now. No more poor practices has to be done, because the chances of cross infections are high. First, second, you may get infection at your home. Till the time we don't have any vaccine or a definitive cure for this, we must practice this in a manner, and if this is inculcated into our habit, we will be practicing good dentistry at all. So that will raise our standards as comparable to the European, basically American and European standards, what they propose, and this will raise our dentistry. Even the chances of the failure of the treatments is being reduced drastically by using such kind of practices. Okay. Now, this is a disclaimer kept at the end. The webinar and the material included has been prepared only for general information purpose, is not intended as a legal advice at all. You have to, if you want to rely on this, it's your choice only. Consult your counsel or check the guidelines by Ministry of Health. They are updating everything on a daily basis. Please follow the Ministry of Health website. Telemedicine is being updated on their website. They tell you how to practice. If you randomly send a medicine to your patient and something bad happens with your patient, you are bound by law. So please follow the guidelines, follow the protocol, and do the treatment. Will serve the community at large. So this is the basic disclaimer. I go through it, and now we are open for the discussions. If you have everything, anything, any question, please get back to me. Mail ID or the WhatsApp number you have, I'll be able to help you. Any queries, any discussions? Hello, please. I cannot hear you. Please say your name. Everyone is mute, unmute. Any question from any person?
Hello.
Yes.
Sir, myself, Dr. Jayant.
Hi. Please tell me.
Sir, I want to ask one question. Suppose the lockdown get
Okay.
over
Suppose the
on
lockdown.
30th of April.
Suppose the
So we should
lockdown gets over.
suppose the get over on 30th April by the government.
Okay.
So we should be practice from the very next day.
My dear, we should be practicing from today only. You have to serve the
Okay.
community. It's your, the only thing that you have to decide is what to treat and what not to treat. Leave the elective treatments. If you have to give a crown over the tooth, avoid it. If you have to do the access opening, emergency access opening, do it on a today basis. Tell your patient that you are going to do it today. Tell about the PPE that you will be wearing, tell about the cost, tell about the inflation in the cost. It's his choice to get it treated. Patient is coming to you for your name. They are not coming to you for the thing that you are cheaper, or maybe you are, you are practicing closer to them. Every patient on the dental chair is not no patient is loving, they don't love the treatment much. They all refrain from the treatment. Every patient on the dental chair is similar. They have one thing in their mind: will it gonna hurt me? It is beneficial for me? Explain them. Once they generate trust in you, you can do any treatment. But at this point of time, do emergency treatments only. Anything else?
Hello.
Yes, please.
Hello. Hello.
Yes, 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 please.
Yeah, Dr. Jairaj here.
Hi, Jairaj.
How frequently are we Hello,
How
sir. That
frequently?
was a nice presentation.
Okay,
We are
thank you.
supposed to change the PP.
Yes.
How
Under the basic,
frequently are we supposed? Yeah.
how frequently? We should
Yeah.
be changing PPE for every patient.
We have to work out on the cost also based on that. That is the
That's
reason I asked.
I agree. I agree. These days, PPE are available expensive in the market. These days only. But I okay.
No,
Have
the
you ever bought? Have you?
availability also is a problem.
Yeah, yeah. But it's just a matter of couple of days. Once the production will be exceeded.
True, sir.
This is
That's right.
demand and supply game. Demand is more, supply is less, so prices are high. Once the demand is reduced, supply is more, prices will drop for sure. At this point of time, you
Right.
may practice by wearing a plastic plastic drapes over your clothing.
Yeah, disposable drapes. That is what we have
Yes,
been using.
plastic disposable drapes, or better to say, you may have seen a simple raincoats, plastic raincoats available
Mm. Yeah,
with
true. Yeah.
elastic bands. So
Mm.
wear your scrub first, clean scrub. Wear that
Mm.
plastic drape that will cost you very less,
Okay.
and then do your treatment. Discard that drape and add the cost to the treatment.
Okay.
Why? See, your treatment is going to be about 10 to 15% expensive. If I believe that a single patient coming to your clinic is going to pay you close to 2,000
Okay.
rupees, an average patient,
Okay.
so you can divide the
Mm.
cost. And the major chunk of PPE is N95 mask. We can use it in a
Mm.
manner.
Right, sir.
Okay.
Thank you.
Okay. Please tell me any questions more. Hello. Any more questions?
Yes,
Please.
this is Dr.
This is Doctor.
Dr. Aman Chaudhary.
Yes, sir. Sir, please tell me.
My question to you is any suggestions you have for having a better health during these dark times?
Oh, obviously, this lockdown period is actually a blessing for those who are staying at home. It's a time to pull our leg back and go back, maintain our health, maintain our family, maintain everything, and learn and acquire the new skill. And when you will be said to run like a horse. So learn better health practices. This can be done. So can you hear me?
Yes, I can hear you. Any specific yoga, aerobics, anything you suggest so that
Sir,
we can
okay.
for the
Uh,
future and
Okay, for that, sir, you have to follow, any of the yoga guru. They'll be the best person to teach you and guide you for that. And just find out.
okay,
Nowadays, even Baba
okay.
Ramdev, I have heard he has started his own webinar sessions, taking yoga online. So you can follow him.
Sure, sure.
Okay. Uh, any other person, Dr. Gurmeet, you want to say something? Okay, I think that I should end the meeting for this now. If you want anything, any checklist or any consent form or anything, you can directly visit our web page of the Facebook. Sorry, it's a Facebook page. Put a comment over there. Uh, ICFAD will surely gonna help you out with that on an urgent basis, and we are always working to uplift the standards of the dentistry by providing good health care to our patients. So this is the basic motto. Practicing on a cheaper price will not solve. Make a difference. Don't negotiate on the terms of price. Negotiate on the terms of quality and the skill. If you are ready to do something in on a cheaper price, other person is available in the market to do it further more cheaper. But the skill or the quality, that is the basic game where you can play and uplift your standard, and that will make you feel satisfied that you are practicing as a dental surgeon. Thank you, everyone. I am signing off for today. If you have any queries or something, please drop us back. We'll get back to you. Bye bye.
ये भी क्या कर रहा है बेटा तू